Okay, good morning, everyone. Thank you for signing into this webinar on the challenges and opportunities in pharmacy. My name is Professor Catherine Burnett. I'm a pharmacist, and in the School of Pharmacy I'm the academic lead for education, but I'm also the pharmacy course director and admissions tutor. So my contact detail is there should you have any questions specifically relating to admissions requirements and things like that for the MPharm course. So as I said, the title was Challenges and Opportunities for Pharmacy. So when I thought about, well, what are the challenges for pharmacy? The main one that you're at this stage of your career really is to become a registered pharmacist. And the only route to that is through an accredited MPharm program within the UK. It is challenging entry criteria, which I'll talk about in a wee minute. And then it's a 4-year degree course. It's a pretty intensive degree course leading to Master of Pharmacy. It's classified as an integrated master's program, but it is, as I say, the only route to becoming a registered pharmacist within the UK. After the 4 years are completed, you then have to do 1 year of pre-registration and training. At the end of that, you have a further examination, which is carried out by the accrediting body, which is the General Pharmaceutical Council. And only then, after successfully completing that year and doing the exam, are you a pharmacist. And to be perfectly honest, I think that's probably the main challenge you're facing at this point. This presentation will look at the content of the 4-year degree programme and will allow you to consider why we think you should take that degree at Ulster in Coleraine. The opportunities are that once you are a registered pharmacist, there is a large diversity in career opportunities in which are expanding all the time. The pharmacist is an essential member of the healthcare team within our health and social care. You will be getting good staff leave and graduate with them. You pick up pre-registration training and stuff like 24,000. There is 100% employability. There are issues in terms of getting training position. That is a 1-year position, and you usually, most students have got that position by the time they're starting between January of 3rd year and going into final year. Average salary, about 3 years out, is about £36,000 to £40,000, and going up to consultant pharmacist, again, I'm going to look at these different roles in a wee minute, is up to about £62,000 as an annual salary. So there is an opportunities there for a well-paid role. And also, we're currently in a situation where there's a shortage of pharmacists in the workforce. There are a lot of vacant positions. In pharmacy, you only need to go on to any of the online portals looking for jobs to see how many pharmacist opportunities that there actually are. A lot of our graduates will choose to be a locum for a short period of time because that allows them a diversity of where they want to work before they will pick up the permanent positions. But certainly career opportunities are at an all-time high, with 100% in our graduate employability. So again, I'll look at career opportunities in this presentation. So the Master of Pharmacy is undertaken in our Coleraine campus. You'll probably be aware that we're a multi-campus university. So it's the Coleraine campus up in the north coast where the School of Pharmacy is, and that's the school building that you can see there on the slide. I should have said, actually, if anybody has any questions as I'm going through these presentations, if you just note them down, our marketing team will answer any that they can immediately, and any others will have the question and answer sessions at the end. Sorry, I should have said that at the start. This slide is showing the entry criteria for our A-levels. Okay, it's 2 A's and a B currently. And of those, chemistry is essential. So you don't have to get an A in chemistry, you can get a B in chemistry, but chemistry must be one of those 3, and you must also have one other science. It says there biology is the preferable other science. The other sciences that we consider are maths and physics. Often I'm asked at this stage, do we look at predicted grades? Do we look at GCSEs? And we don't, in terms of whether or not you'll get an offer is generally determined by whether or not you're doing the right A-level subjects. I noticed there was one question in there. I'm just going to say, okay, hopefully marketing can sort that one out. So the MPharm is a clinical degree underpinned by science, and I suppose because a lot of people will say, well, why is chemistry essential? This is a healthcare profession, which yes, it is, but very much is a clinical degree underpinned by science. So why is science important? Well, the reason science is important for pharmacists is how drugs work. What drugs you choose to treat patients is very much related to their structure and functional groups. And you may come across the term the scientist in the high street, and this really refers to the years of scientific education that pharmacists have um, before they are a pharmacist within the community setting. So they really are a scientist on the high street. Initially, pharmacy was very much just a BSc, scientific degree, and then the MPharm as it became more clinical. So just to illustrate this point, I thought it might be interesting to show you you don't need to know this, obviously, but this is benzoyl penicillin. It's beta-lactam, which is indicated there. It has a thiazolidine ring, and it has a side chain. And benzoyl penicillin was obviously one of the first antibiotics that was discovered. But there's a lot of weaknesses. It has a restricted antibacterial spectrum, so that's in terms of the number of bacteria that it will actually be able to kill. So what happened is that side chain in the previous structure was altered, and the altering of that produced the antibiotic ampicillin, which maybe some of you have come across, and it has a much broader spectrum of activity, so it can kill more bacteria. Another issue with benzoyl penicillin was the reactions, the hypersensitivity reactions that can cause. You'll know that a lot of people are allergic to penicillin in itself. Benzoyl penicillin is also broken down by gastric acid. So gastric acid is the acid within the stomach. If you took benzoyl penicillin orally, in other words, if you swallowed it, it would be broken down. It would be ineffective. And again, a derivative of benzoyl penicillin to overcome that weakness is penicillin V, phenoxymethyl penicillin, which is acid stable. So you can take it orally and it will exert its effect. Also, the absorption of benzoyl penicillin is not good due to its chemical structure. So again, modification of the molecule that leads to amoxicillin and pivampicillin. Again, these are modifications of the side arms. So whenever you have the side chain here, by modifying it, you can alter the structure of the drug. The beta-lactam ring is what makes it active against the bacteria, along with the thiazolidine ring. So it's the side chain that these changes happen with. Benzoyl penicillin is also eliminated from the body by the kidneys very rapidly. You get rid of it very quickly, and again, changes to that chemical structure allowed us to co-administer it with other drugs to slow elimination. And finally there on the slide, the beta-lactam ring, which exerts its effect, is broken down by many bacteria, hydrolyzed by beta-lactamases, including Staphylococcus. You'll have heard of methicillin-resistant Staphylococcus aureus, MRSA, and the problem that we have within our hospitals due to MRSA bacteria. So what they do is they break down that beta-lactamase ring. They break this down. If that's broken down, the drug cannot exert its effect. So again, science of drug treatment allowed us to combine the benzoyl penicillin with clavulanic acid, which is a beta-lactamase inhibitor, to produce co-amoxiclav, which some of you may come across, and that overcomes that problem. So that really, those two slides really were to show you why science is important for pharmacists, because it's important that we understand how we can develop drugs to overcome problems with drugs and to ensure greater patient treatment and outcomes. So our Master of Pharmacy, as I've said, is a 4-year program. It's what we call a fully integrated curriculum. And what we mean by that is that the elements of chemistry, biology, pharmacology, pharmaceutics, therapeutics, pharmacy practice, and clinical pharmacy are all taught through core themes. And these core themes you can see on the slide there are cancer, infection, immunology, cardiovascular, endocrine, renal, nutrition, and blood, respiratory, reproductive, UT, skin, GI, and liver disease, and the central nervous system, joints, eye, and ENT. So if we take, for instance, the cancer, infection, immunology theme, within that, in level 5, Molecules to Man 1, you will have lectures on chemistry, the chemistry of the drugs used to treat those conditions, pharmacology, how those drugs work to treat those conditions. So pharmacology is about how the drug acts in the body, what sites it binds to. Pharmaceutics is how those drugs are manufactured, Why would one drug be in a tablet form? Why is another drug in a liquid form or a suspension form? Why do you need different forms? Paracetamol comes in tablets, soluble tablets, capsules, liquids. Why do we need all those forms? That's what pharmaceutics is about. Therapeutics. When do we use certain treatments for certain conditions? And pharmacy practice and clinical pharmacy is really all about putting all of those elements into practice to treat patients to optimize their outcomes. So all of those themes are very much taught through, as you can see in the diagram there, level 5 molecules to man 1, level 6 molecules to man 2, and level 7 molecules to man 3. And they're underpinned by the basic sciences or their foundations of pharmacy, which is in level 4, and that's year 1. In level 7, in your final year, you'll also undertake a research project. This will be an independent piece of research, large piece of research that you'll undertake yourself to the submission of a thesis. And throughout all of this, the backbone is the pharmacy practice skills. So through all of these, in all your 4 years of study, your pharmacy practice skills provide the backbone and will integrate across all years of study and within each year as well. So what we have is a spiral curriculum. You can see the professional practice skills backbone there, and basically your underpinning science and your knowledge of therapeutic area teaching spirals up to level 7, where you have mastery of your understanding before you graduate with your MPharm degree. So that's the basis of the 4-year program, and again, happy to take any questions on that at the end of the presentation. Then you undertake your pre-registration year. Your pre-registration year is split. It can be split into 2 6-month periods. Pre-registration training opportunities can be undertaken in community pharmacy, hospital pharmacy, and in the industry sector. You can do 6 months in industry. It must be the first 6 months, because the last 6 months has to be in a patient-facing role. So the last 6 months would be in community or in hospital. Or you can choose to do 12 months in community or 12 months in hospital. After your pre-registration year, your career options are there. Your community pharmacy, hospital pharmacy, industry. You can go into prescribing advisors and medicines management advisors as a practice-based pharmacist. You then can also do further education and training and become a non-medical prescriber. We have consultant specialist pharmacists. You can work in research in academia, or you can work as a pharmacist in non-government organisations. So let's just spend a time now looking at each of these roles. This slide, first of all, showing where pharmacy is in the workforce in 2019. And you can see the vast majority of pharmacists are still working in the community, and over half of pharmacists now work in community. That said, it used to be about 75% of pharmacists work in community, and you'll maybe see the 314 here, which is our general practice pharmacists. And this has been an initiative that was started about 3 years ago, that all general practices within Northern Ireland now have a practice-based pharmacist working in them. And a lot of the pharmacists went from community into the general practice route. We still have about 637 pharmacists then obviously working in the hospital. Those are the 3 main employing areas for pharmacists within Northern Ireland. But you can see the other areas that pharmacists in Northern Ireland work in. Academia, there are 73 as of last year working in locum. As I said, some younger pharmacists prefer that to start off with pharmacists employed in the board, in industry, as administration, enforcement, and just in various other roles. So if we look at the community pharmacists and the core functions of the community pharmacist, you'll all be familiar with your community pharmacy and the dispensing of prescriptions. And it really is the core function of a lot of community pharmacies. The pharmacist's role in that process is actually the safety of the prescriptions. So they'll ensure that the prescriptions and the medication labels are legal and accurate, and they will advise patients on when and how to take their medicines, any possible side effects, what to do if those side effects occur, and any other medicines to avoid while they're on that prescribed medication. They really no longer do the dispensing. It's usually done by a technician within a community pharmacy setting. Community pharmacists will also do responding to symptoms. You go in, you have a cold or you have a headache, and you'll be looking for over-the-counter medicines, and you'll get advice on those from the pharmacist. And then there's the additional services which are undertaken within your community pharmacy setting now: minor ailments scheme, the public health schemes including smoking cessation, weight management, substance misuse support, needle exchange, methadone substitution. There's point of care testing now in many community pharmacies where you can get your blood glucose, blood pressure, a cardiovascular risk assessment undertaken. Community pharmacists carry out medicines use reviews, patient education. They'll also look after a lot of nursing homes for supply and domiciliary oxygen. So the additional services of the community pharmacy are absolutely getting larger all the time. As a community pharmacist, you would also have a management role. You'd have responsibilities for looking after the staff within the pharmacy that you're working in. And they could include finance, personnel management, stock control, marketing, merchandising, health and safety, regulatory compliance. Then we move into the next biggest employment area, which is the hospital pharmacy. And hospital pharmacy are to have different sections within them. And we look at patient services first. Patient services within a hospital pharmacy department are really the area which look after discharge prescriptions. They look after the supply of medications, dressings, fluids and sundries to the wards. They look after the controlled drug supply. So these are drugs that have greater legislation control over them. The hospital pharmacy team would also be responsible for outpatient dispensing, so hospital-only prescriptions. Some patients get prescriptions only from the hospital and don't get them from the general practitioner. And also extemporaneous dispensing. So there might be patients in hospital that are usually prescribed a tablet, but for whatever reason they cannot take that tablet, they can't swallow the tablet, and the tablet needs to be reformulated into a liquid. And the hospital pharmacy would be responsible for ensuring that is done safely, accurately and appropriately. Within hospital pharmacies, we also have aseptic and chemotherapy services, and they're responsible for the preparation of parenteral nutrition. This is where patients can't eat and they're getting their nutrition parenterally through their veins, through their blood supply. And obviously they need monitoring and adjustment of that feeding regime to make sure that they are doing well. Aseptic services will also prepare chemotherapy, so those are cancer treatments, and look at dosage recommendations for the cancer treatments, and the preparation of intravenous antibiotics for patients, and any other agents that require special handling. Pharmacy has a very pharmacy presence, and this is where you have the ward-based pharmacists, and they will take drug histories for patients. They will monitor the patient's drug therapy. They'll certainly be involved in interdisciplinary ward rounds, on inpatient counselling and discharge prescription counselling. They'll look at pre-admission clinics, patients that are maybe coming in for surgery. They will have a pre-admission clinic to consider what drugs should be stopped before the surgery and what drugs will be safe enough to keep taking during the surgery. They'll counsel outpatient clinics and maybe run outpatient clinics. And they'll also liaise regarding discharge and oxygen supplies. And what the pharmacist's role is really all about is medicines optimization. Medicines optimization is about ensuring that the patients, public and society get the best outcomes from their medicines. And pharmacists are the ones that provide leadership and support in that role. But the principles used for medicines optimization are used by everybody within health and social care. And medicines optimization really is about ensuring that the right patients get the right choice of medicine at the right time. There's 4 principles to medicines optimization. The first one is understand the patient's experience. It's reckoned that about half of patients don't take their medicines as recommended, and this is a really important role for pharmacists. There must be dialogue with patients, so that they're experiencing the use of the medicines is the experience that you want them to have. To accept and want to take the medicines, including choices about prevention and healthy living. And this is an example of a pharmacist's role in applying Principle 1. A patient home from hospital kept missing his dose of antipsychotic medicine because it was labelled take 1 tablet in the morning. He frequently woke after midday. Because he had been advised to take the tablet in the morning, he missed it for 3 days running. That's the specialist psychiatric pharmacist, suggested he change the time that suited him, for instance 1 p.m. Timing wasn't really important as long as he didn't take didn't make him drowsy, just that he took it once a day. Changing the timing of the dose to fit in with his lifestyle helped him to adhere to his medication and improved his chances of a positive outcome from the treatment. So that's an active example of how pharmacists can liaise with the patients to ensure that they can get the best use of their medicines. Pharmacists are also involved in evidence-based choice of medicines. Choice must be informed by the best available evidence base. And this is often where you maybe have heard on the news about the National Institute of Clinical Care Excellence. It's NICE, where NICE say, yes, this drug can be prescribed on the National Health, or no, this drug cannot be prescribed because of the evidence is not there for the benefit of the drug. So it's important that decisions about access to medicines are transparent, that medicines that aren't needed are stopped, and anything that of clinical value is not used. And again, this is an example of a support pharmacist involved in a multidisciplinary team that looks at medicines patients on high risk of hospital admission. They recently referred a patient to the pharmacist taking 35 medicines. And the pharmacist was able to make recommendations which included reduction of an antipsychotic medicine due to its effects on cardiac risk and diabetes control. The pharmacist recommended stopping medicines that were no longer needed and recommended that the patient's inhaler technique and insulin device use were checked, and a steroid should be added for regular use. That would be for the inhaler. Obviously, they were using their blue inhaler, as a lot of you will know, too often, and they recommended using a steroid for regular use. The review resulted in the patient having to take fewer medicines, a better quality of care, and a reduction in the likelihood of being admitted to hospital. So again, an active example of the principle 2. Medicine use must be as safe as possible. Safe use of medicines is the responsibility of all the healthcare professionals, and it covers medicines use, including unwanted effects, interactions, safe processes and systems, and effective communications between professionals. So again, an active example of Principle 3 from lead pharmacists working within a hospital was a patient was admitted with low blood pressure, and when the pharmacist looked at the medication the patient had brought in, the pharmacist noted there were 2 boxes of the same blood pressure medicine in different packaging. So after a recent hospital admission, the patient had been discharged with a box of the medicine, but because it looked different to the box they'd received from their community pharmacy, the patient thought they were different and had been taking them both, and this had resulted in the lower of the blood pressure. It was an unnecessary readmission and it could have been avoided, but it was the pharmacist that found this error. And finally, Principle 4 of medicines optimization is just to make medicines optimization part of routine practice. For all healthcare professionals, and very much pharmacists is seen as the lead person within the team to try and do that. That's just an illustration of the role of medicines optimization for pharmacists, and very much within the hospital they can practice that. Also within hospital pharmacy, we've got medicines information, and these support the clinical pharmacists, nurses and doctors with medicines information inquiry answering services. They'll also prepare bulletins outlining particular areas of interest like new products, and keep up to date with journals and textbooks. And then there are other hospital roles, pharmacoeconomic pharmacists looking to make sure that we got the best cost-effective use of our medications, procurement, so buying in the medications, and education. So it's community and hospital pharmacy. We also have pharmacists working within the pharmaceutical industry, and these will develop, use and market drugs licensed, responsible for analytical techniques, formulation, manufacturing, quality processes and control. And they'll certainly be involved in clinical trials, regulatory effects. Within care, then we have, as you saw, the large group now of pharmacists working within primary care. They'll support prescribers in all aspects of their prescribing. They'll give advice, education and assistance to prescribers. They'll look at prescribing patterns within general practice. They'll certainly very much develop and implement drug formularies and guidance. They look at interface issues, and interface issues are issues that relate to where a patient is being discharged from hospital back into the... And they'll monitor prescriber expenditure, they'll answer queries, and they'll work with interdisciplinary working. And they will also carry out patient clinics in their own right. They'll carry out medication reviews, they'll be responsible for staff training, they'll do problem and query solving, and they'll also prescribe in their medicines management clinics. Then our next biggest group probably in Northern Ireland is our academic pharmacists, of which I am one. Also, we're obviously involved in teaching undergraduate, postgraduate students, pharmacy technicians, and also a CPD, which is continual professional development. Academic pharmacists are also involved in research, looking at drug delivery, biomaterials, infection control, medicinal chemistry, drug discovery, and clinical pharmacy and primary care. We also have a role which is known as a teacher practitioner pharmacist. These pharmacists will spend about 60% of their time working in hospital, community or industry, and the rest of their time they'll work as an academic pharmacist. We have a teacher practitioner network within Northern Ireland with teacher practitioners within all the trusts except the Belfast Trust. As I mentioned earlier, pharmacists can also do continuing education to become prescribers. They're known as non-medical prescribers, and they join the group of nurses, dentists, and physios, optometrists, and radiographers. And they can practice within hospital, within GP practice, and within community. So certainly we have a lot of prescribing pharmacists now within Northern Ireland. The role of the consultant pharmacist was established in 2001. And it's a senior career position for clinical pharmacists within hospitals. They deliver a high level of pharmaceutical care to patients. They will be prescribers. They have a patient care role and are there to improve the outcomes for patients. They'll often be involved in specialist areas, for instance, cancer care, in use of antimicrobials, and in ICU departments, rheumatology clinics, etc. I just put in this slide really to illustrate the flexibility in the career pathway for a pharmacist. So whenever you graduate with your MPharm, you can work in any of those areas that I've just spent time going through. Even if you do your pre-registration year in one area, in community for instance, it does not exclude you or mean that you have to work in community pharmacy forever. You could certainly apply for a role in any of the other provisions of pharmacy workforce. It will be a career of lifelong learning. You'll be continually learning and developing as you go along. And I just wanted to illustrate here my own career pathway in pharmacy, and it's certainly been a very rewarding career for me. Initially, I did my pre-registration year with Boots, so I went into community pharmacy and worked with Boots for about 6 years. And through that time, I went through from pre-registration pharmacist to management trainee to relief manager. And then in mid-career, I took a move into the hospital, into the Northern Health and Social Care Trust. And during that time, I also completed my PhD. I also did some part-time work for the Pharmaceutical Society of Northern Ireland, who is our regulator within Northern Ireland. And I completed an advanced diploma in management practice. So you can see, even mid-career, my lifelong learning was still at the fore there. But I was at this stage working within the hospital as an audit pharmacist. And then late career, I moved again into academic pharmacists in 2008 when Ulster University opened up as a School of Pharmacy. And during that time, I've completed a postgraduate certificate in higher education. But I do still work as an as and when hospital pharmacist. So your paths can diverge and overlap and come back again. And the great thing about a career in pharmacy is you're never pigeonholed into one area. You can stay in one area if that's what you like to do, but the opportunities are great for movement. And in fact, I'm currently working in the hospital looking at the PPE supplies that, as you know, we're all in the news at the minute. So before I finish up, I just have a few slides on why I think you should choose Ulster to do your MPharm degree if this is a degree for you. Certainly the School of Pharmacy and Pharmaceutical Sciences has the evidence to back up that we provide a first-class education. Ranked #1 in the Guardian League tables in 2014 to 16 for pharmacy and pharmacology. And then in 2018, we were #1 for pharmacy in the Guardian League tables. We also have first-class facilities. We have the state-of-the-art purpose-built facilities for teaching pharmacy and pharmacology. Within that, we have a model pharmacy. So students can actually practice responding to symptoms and dispensing within a pharmacy that looks like your community pharmacy down the street. We have a fully functional aseptic suite. So if you remember when I was talking about the roles of the hospital pharmacist and I talked about aseptic and chemotherapy, these are manufactured under sterile conditions, and we have an aseptic suite for students to learn how to do that. We have a 50-station computer suite, which is just for our pharmacy students, and we would use that for teaching, and students can use that for their own work as well. This is in addition to the Learning Resource Centre within the main building. And we have fully equipped pharmaceutics, pharmacology, and chemistry laboratories, as well as cell culture facilities. Another of our unique selling points at the School of Pharmacy and Pharmaceutical Societies is our small class size. We usually take about 40 students onto our MPharm programme. That does mean that you have an excellent student-staff ratio of 1:14. You're in small classes. It's very much a collegiate atmosphere. You get to know all of your fellow students. They get to know you. You'll also get to know the students in other years. But also important is you'll get to know staff, and staff will get to know you. And that allows us to give you the support that you need throughout your 4 years with us. Another unique selling point is our placement allocation. We have community and hospital placements throughout all 4 years of our programme, as well as industry within year 2 and year 3. And these are all arranged by the school. They're within modules. You have learning outcomes associated with your placements. You don't need to use your holiday time. And we train your placement providers on what is expected of you during that period of placement. We also have a pharmacy job shop with strong links with lower employers. Part-time vacation opportunities and pre-registration opportunities are sent directly to students to your email accounts, and we put them onto our online virtual pharmacy job shop. You benefit from that as a student, because when it comes to part-time work, we know a lot of you will want to have part-time work. It's beneficial for you to have that within pharmacy. It's also beneficial for the employers, because they get to see what you're like. They may eventually offer you a pre-registration place as a result of the work that you've done for them throughout your undergraduate career. And a lot of our students have pre-registration places in this way. I mean, what we aim to do as a school is to produce graduates who will be the best that they can be in their chosen field of study through first-class education, support and mentoring. We aim to enable all students to achieve their own academic potential and personal potential to be effective global citizens. And we want our graduates to look back over their 4 years of study and know that while they worked hard, they also had fun receiving a first-class education in a school that cared for them on a personal level. Some of our graduates have said things like the facilities are first class, the teaching was excellent, the placements were really good, the availability of the staff and the structure of the course and the small class sizes. Got some quotes from alumni. Sarah Gardner is a 2016 graduate. She's actually now with us as a PhD student. She thoroughly enjoyed my time at Ulster studying pharmacy. Small class size allows you to form a close relationship with your peers and allows the staff to build a rapport with students. All the staff are approachable, extremely enthusiastic, both in their teaching and research, and it was their enthusiasm that inspired me to return to do a PhD. Another quote there from Laura Hutchinson, who was a 2014 graduate. Louise Toner was a 2013 graduate. She was one of our first graduating cohort, along with Rebecca Kennedy, the other quote there. And Louise said it was the single best decision she made as a 17-year-old to select pharmacy at Ulster on her UCAS application. And Rebecca said she would strongly encourage anyone hoping to study pharmacy to choose Ulster. And she also says that outside of the classroom, the North Coast is a great place to be a student, which I would think would be very true. I think our marketing team might come in here.
Yes, super. Thank you, Kathy. So just quickly, guys, my name is Michael. I work in student outreach and recruitment. You'll see there, Kathy's just showing the events page. So all our webinars are on there. So this is a series of ones we've been holding. So do please make use of that facility. Log on there and you'll see a whole range of webinars that are taking place. And as I say, just go there and you'll be able to register just like you did for today's, and hopefully find out a wee bit more information about our courses. On the next slide, we have our information concerning our open days. So at the minute, we're just planning. We're not sure how that's going to work out. on the next slide here, you'll see the dates that we have set aside for those open days. So your schools will be able to register for those various days. You as an individual, as a student, you're not able to register just yet. Your school will go on there, register to attend a certain day, and then later on, hopefully towards the end of May, start of June, you as individuals, as students, you'll register then to attend a certain day, whatever day your school's coming, and then whatever talks you would like to find out about. Obviously with the pharmacy course, it's up at our Coleraine campus. That's Friday the 25th. We'll also be having then a Parents' Day on the 26th as well, so you could maybe come up that day on the Saturday. But hopefully if they do run, as Kathy was saying there, where you'll be able to see the facilities, have a look around, there'll be a talk, there'll be a tour, you'll get to look around the campus and see the facilities and the dispensary and where you'll be taught for your pharmacy course. And then the next slide.
Maybe I'll just maybe interject there, Michael, just to say that I know that a lot of schools will just register for the Jordanstown Open Days. We've found that in the past, especially if your school is based around the Belfast area. I would strongly recommend that you do come up to the Coleraine campus to see our facilities. Really just re-emphasising what Michael has said there, and the Saturday, all being well, the Saturday will be what that will be, or later on in the year. But certainly it is worth coming up and seeing the facilities to really know, because it's somewhere you're going to be for 4 years. You need to see it. Okay. Sorry, Michael.
Absolutely. No worries. No. And then on our last slide, there's just general information on contacts. Kathy gave out our email address at the start, or there's our study email. There's a Unibuddy, sorry, on the next slide there. It might come up. On the Unibuddy, which is where you're able to interact with students. So if you go onto our website, Unibuddy will pop up, and that's our current students. So if there's anything you want to engage with, find out about, asking more information about the courses, those guys are on there to find out. So I'll not hold you back anymore. There's a few questions that have come in, Kathy, that have just said you'll be able to answer live. They were just a wee bit concerning the course and stuff. So the first one is it possible to do pharmacy without the MA component?
I'm not sure what you mean by the MA component. Pharmacy is an MPharm.
So it's a full master's,
it's a full integrated master's. It's the only way to be a pharmacist. So you can't be a pharmacist unless you have the MPharm. There obviously are exit awards throughout the 4 years, but they're not awards that would allow you to be a practicing pharmacist.
But you wouldn't be a fully qualified pharmacist at the end.
Exactly. Yeah. I mean, if you didn't want to be a pharmacist, but you're interested in the science of the drug discovery and development, then we do offer an MSci Pharmaceutical Bioscience, and that might be the course to go for. If you want to be a pharmacist, you're going to have to do the MPharm somewhere.
Perfect. Okay. So another wee one here, just if a student has taken maths, chemistry and history at an A level, but not the preference subject of biology, will they be at a disadvantage?
No, as long as they've chemistry. You said, so I'm assuming you mean maths, physics, history and chemistry. I think those were the three you said. Chemistry is essential.
No, I know that the student just said maths, chemistry, history.
Oh, maths, chemistry, history. No, that's fine. I know that the slide said biology was preferable. We do physiology and anatomy in first year. So therefore you get enough of the physiology and anatomy.
Up to speed.
We don't rank offers based on the other subjects. So no disadvantage at all.
Perfect. Can you travel and practice in different countries with an MPharm degree from Ulster Uni?
It varies throughout the world. I mean, I would like to say, to be honest, I don't even know what's happening with Europe after Brexit. So your MPharm is a UK registrable degree. Some countries, I know Australia, you can do a short period of training and you can work in Australia. So the Commonwealth countries you tend to be able to work in. But no, it's any MPharm degree is just a UK registrable degree.
UK, okay.
Yeah.
And John has asked, does the MPharm allow you to dispense veterinary medicines?
Yes. A pharmacist is is it POM VPS, whatever that legal classification, which I should know. For veterinary medicines, a pharmacist can dispense veterinary medicines, but only on a prescription from a vet. A pharmacist
Yes.
cannot write veterinary prescriptions. Just to make
Perfect.
that clear. Yeah.
Perfect. Thank you, Kathy.
Okay.
Yeah, that's I've rattled through everybody there, I think. Does the degree allow you to work in the south of Ireland?
Okay, so the current update from the Pharmaceutical Society of Ireland on their website, up until Brexit, yes, the answer was yes, without any issues at all. That is still a work in progress. Currently, the Pharmaceutical Society of Ireland are saying that pharmacists may need to do a further period of training down in the south of Ireland. However, that hasn't been worked out, and what I would say is that the south of Ireland has always been a net importer of pharmacists because they only have 3 schools of pharmacy. Their workforce relies on pharmacists coming in from the UK. So we feel that they aren't going to put in any unnecessary blocks, but that Brexit has had an impact on that, in that we still are not sure of what that's going to look like.
Fair enough, yeah. And there is concern that whole area for the university. There's obviously a lot of uncertainty, but we're
absolutely,
hoping, as you say, there'll be a lot of positives, that why would they put anything in place to harm students going down when they need more students?
They need them.
Yeah.
I mean, we currently, our cohort, just for those that are listening, our cohort is about a third of students that have come through the Irish hires. And if any of you are on from the south of Ireland and are interested in or asking qualifications for that, obviously get in touch. So we have a large contingent from the south of Ireland, and obviously we're watching this space very closely. I cannot see that they're going to put any barriers in place.
Yeah, perfect. That's grand. Nothing else coming in there, Kathy. But just to reiterate, just again, feel free to get in touch with Kathy and the guys up at Coleraine and that around that whole course. To be more than willing to answer any questions, and then when the time comes throughout year 14 or second year of your BTEC or your studies, whatever it is you're doing, there'll be opportunities for you to go up to the campus, get a good look around, see what goes on, the accommodation, have a look at the facilities, what your life would be like for studying and working up around the North Coast. So there'll be plenty of opportunity for you to do that, and hopefully you will all be in a better place come September, where we'll be able to have those opportunities. So
And if for any reason anybody does want to come up and see around the school but cannot make the open days, just get in touch. We're more than happy to show individual prospective students and their parents around at a time that we can. Obviously, with COVID, we're still not sure
how that's going to work, but we'll do our best.
We certainly, so certainly we've an open door policy in terms of showing people around.
Totally.